My name is Nonhlanhla Malevu, and I'm here to present the Hosmed 2021 product. We'll start with our Plus option. For in-hospital, the Plus option will still allow you to use any hospital of your choice, and the benefits will remain covered at 100% unlimited. Regarding your out-of-hospital consultations, your GP and specialist consultations get 26 GP visits on the Plus options, and we've also added 9 specialist visits per family. There is, however, a co-payment that has been introduced, which is a 30% co-payment that you will have to pay after the 10th GP visit per beneficiary. Your acute medication is limited to an amount of 15,350 Rand, and there will also be a 30% co-payment after a utilization of 9,920 per family. Your chronic medication remains unlimited for PMB chronic medication. Your non-PMB chronic medicine will be limited to an amount of 28,090 Rand per family per annum. The radiology and pathology for the year 2021 will be a combined benefit. That means there will be an amount of 5,425 on the Plus option that will apply to both your in and out of hospital radiology and pathology. There is, however, also a sublimit of 5,100 per beneficiary for your pathology and 3,750 per beneficiary for your radiology. PMBs will still be paid even when your combined benefit has been exhausted. So that basically means that in the event where your combined pathology and radiology has been exhausted and you have a PMB condition that requires the use of these services, those claims will still be paid. Dentistry, your conservative will remain unlimited with, of course, that treatment protocol of once every 6 months per beneficiary, and your advanced dentistry is limited to 8,580. Our new optometry benefit, the service provider will then be ISOLESO for next year. It is still available once every 2 years. Your frames and lens enhancements are covered at 1,230, and your contact lenses will be covered at 2,915. It still is also an option of either or, so it's either the frames or lens enhancements or the contact lenses. You cannot get both glasses and contact lenses. Our contributions for the Plus option in 2021, there has been a 6.5% increase in contributions for this option, which means that the main member will pay a contribution of 5,642. Each adult dependent will be an amount of 4,693, and for each child dependent, it will be an amount of 1,052. It still remains as well in 2020 that you will pay only for the first 3 children across all options, and if your child is over the age of 21 and still studying, they will be covered until the age of 26, subject to an annual review. The value option for 2021, your GP and specialist consultations, there will be 20 GP visits per family per annum and 7 specialist visits per family per annum. Co-payment applied is 30%, which will come into effect after the 7th GP visit per beneficiary. Your acute medication is limited to an amount of 9,550 per family, and there will also be a co-payment of 30% for overutilization above a limit of 6,075. Basically, what that means is that once you have reached that 6,075, you will have to pay 30% towards any acute medication. Medical aid will pay 70%. Chronic medication, your PMBs remains unlimited, and your non-PMBs will then have a limit of 13,960. The combined radiology and pathology benefit for 2021 has a limit of 3,580. The sublimit thereof is 2,780 for your pathology, and your radiology is 2,170. That still remains per beneficiary. Conservative dentistry is unlimited once every 6 months, and your advanced dentistry will be limited to an amount of 6,370. Optometry again is once every 2 years. Frames and lens enhancements will be covered at 795 Rand. Contact lenses will be covered at 1,810. The increase for the value option for 2021 is 3.7%. Main member will pay a premium of 3,495. An adult dependent will be an additional 2,835, and for each child dependent will be an amount of 660. The value core option for 2021 has brought about some changes. The GP consultations will now be unlimited on the value core option, but it will be subject to the use of a designated service provider. There will be 7 specialist visits per family. If, however, there is voluntary use of a non-DSP, which basically means that you are not using any of the GPs on the list, there will be a 30% co-payment. Your acute medication will also work a little differently for value core in the year of 2021. There are 2 limits. The first limit will be unlimited if your GP is dispensing medication. If your GP is not dispensing medication and they are giving you a script to go to the pharmacy, there will be a limit of 9,550 on that medication. Again, with chronic medication, PMB will remain unlimited. Your non-PMB will carry a family limit of 13,960. Combined radiology and pathology will be 3,580. Conservative dentistry remains unlimited, and your advanced dentistry will be limited to 6,370 per family. Optometry, frames and lens enhancements will be at 795, and your contact lenses will be covered at 1,810. The increase as well for the value core is at 3.7%. The main member will pay an amount of 3,215. Each adult dependent will be 2,610. And for a child dependent, it will be an amount of 610 Rand. Our savings option, which is our access option, still makes use of the medical savings allocation. Allocation is dependent on your family composition. The GP and specialist consultations, as well as your acute medication, as well as your radiology and pathology, will be paid from your medical savings account. Once your medical savings have been exhausted, we still give an additional 4 GP visits for the family. And for 2021, we have added 1 additional specialist consultation per family with either a gynae or a pediatrician. Dentistry remains as a risk benefit. It will not be paid from your savings. Your optometry also remains a risk benefit. It will not be paid from savings. The optometry limits for your frames and lens enhancements, you're looking at 548, and your contact lenses are at 950. In the year 2021, we have also introduced an option for members on the access option where they will be able to use their accumulated savings to pay towards optometry. So in the event where a member has chosen a frame or lens enhancement that has gone over the amount of 548, they will be able to use their accumulated savings to add in for that amount, whatever the amount then may be for the frames and lens enhancements. Regarding the contributions for the access option in 2021, there has been absolutely no increase on the access option, which means that for 2021, your main member on access will pay an amount of 2,450. An adult dependent will pay 2,110, and each child dependent will pay 476. The savings breakdown or savings allocation, main member will be allocated an amount of 5,880. For each adult dependent that they add will be an additional 5,064. And for each child they add on will be an additional 1,142. But do remember that in the case of a child dependent, because you are only paying for 3 children, if you add more than 3 children, the savings allocation will still be only for the 3 children that you are paying for, not the additional children that you won't be paying for. Our essential option still remains as a PMB option for both in and out of hospital. Your GP and specialist consultations, your GP consultations are unlimited within a DSP of doctors, and you will have 3 specialist visits per family per annum. If there is any voluntary use of a non-DSP for your GPs, there will be a 30% co-payment. Your acute medication, again, will be unlimited if your medication is being dispensed by the GP. However, if you are getting medication from a pharmacy, there is a limit of 3,540. Chronic medication on the essential option is only available for PMB chronic conditions, and it will be unlimited. Radiology and pathology will be limited to PMBs at an amount of 863 per beneficiary for radiology and 863 per beneficiary for pathology. Conservative dentistry is unlimited once every 6 months per beneficiary, and the advanced dentistry will be limited to PMB conditions only. Optometry available once every 2 years. Frames and lens enhancements will be covered at 300 Rand. Contact lenses will be covered at 645 Rand per beneficiary. The increased allocation for the essential option is at 3.9%. It is income-based, so if a main member earns between 0 and 8,500, they will pay an amount of 1,480. If they earn between 8,501 and 13,000, they will pay an amount of 1,773. A main member earning anything above 13,000 will pay 2,131. The overall annual increase for Hosmed in 2021 is sitting at an amount of 3.9%. We thank you for your time, ladies and gentlemen, and enjoy the rest of your day.